Hello, I'm Dr. Carlos, internal medicine specialist and medical director at Medicine Specialist. Today, I would like to discuss the critical aspects of ibogaine treatment, promising therapy with remarkable potential that I've witnessed firsthand in patients struggling with Parkinson's disease. Also, traumatic brain injuries, addiction, PTSD, depression, anxiety, and other mental health conditions. Since 2010, I've led medical teams with an unwavering commitment to safety, ethics, and evidence-based care. Our pledge is to respect the hard-won scientific gains of those who have come before us, to share the knowledge of those who will follow, to uphold ethics, respect patients, prioritize their well-being, and emphasize compassion and high standards of care. I am grateful to public figures like Joe Rogan, Rick Perry, and Bryan Hubbard for using their platforms to raise awareness about ibogaine's life-changing potential. Through their advocacy, more people are learning about this ancestral medicine, and the results I've seen in clinical practice have been extraordinary. Now, I would like to talk to you through key considerations about ibogaine treatment, ensuring you have the accurate, responsible information that you need to make an informed decision.
With misadministration, there is a significant cardiac risk which accompanies ibogaine. It has the propensity to prolong the beats between the heart, or what is called prolonged QT interval. The fancy word for it is Torsades syndrome.
Okay, to explain a little bit of what he just mentioned, a QT prolongation is something that we can either be born with, which is congenital long QT, or is something that can be acquired, which is an acquired long QT. Now, this, for example, usually happens throughout life, is accompanied or usually caused by other either health conditions, body mineral abnormalities, mainly magnesium, potassium, calcium, or by medications that we might be taking that can prolong the QT. Now, to explain what the QT is, a QT prolongation or a long QT syndrome is slowing down of the repolarization of the ventricles, which basically means that the heart takes a little bit longer to recharge between one beat and the next. Now, that can lead to different type of irregular heartbeats, arrhythmias, one of them being torsades. So it is not the same thing, it is not a fancy word of one explaining the other. Rather, a QT prolongation can lead to torsades. Now, torsades is polymorphic, which means that it has different shapes, and it's a ventricular tachycardia.
If an individual is given ibogaine improperly, it will slow and stop their heart, and they will die. This is a very serious medication.
Okay, so what he's trying to say here with ibogaine slowing your heart, ibogaine has the propensity to either slow down your heart, which is called bradycardia, and in itself can also prolong the QT. Now, somebody with a prolonged QT, that their heart rate goes to an extremely low rate, that can turn a QT prolongation into torsades. But torsades is not a slow heart rate. Torsades is a ventricular tachycardia. It's a fast, irregular heart rate.
And it must at all times be administered by a medical professional with a background in interventional cardiology, supported by a nursing team that can deliver the administration of atropine to stabilize the heart's rhythm if it goes out of whack.
Okay, yes, I completely agree that ibogaine must always be administered by medical professionals with experience using the medicine, but it does not necessarily have to be an interventionist cardiologist. Within the field of cardiology, there are subspecialties. Intervention is being one of them. But any trained cardiologist, internal medicine specialist like myself, emergency medicine specialists that have experience using ibogaine, that know and can identify all the different type of irregular heartbeats and know how to treat them, can basically do ibogaine treatment. It doesn't necessarily have to be an interventionist cardiologist. But yes, they all must know how the medicine works, how to identify irregular heartbeats, and how to treat them. Ideally, as we've mentioned, the medical team must all be ACLS certified.
During the course of treatment, The other important thing to know is, though that risk exists, it can be fully and completely mitigated by the co-administration of magnesium.
Now, what he's mentioning here about using atropine, atropine is used in patients that have a slow heart rate, which is basically called bradycardia. Now, not every patient that has a slow heart rate needs the administration of atropine. Some patients, especially like, for example, healthy individuals that exercise a lot, might have a slow heart rate to begin with. Low to mid 50s, high 40s. That does not mean that these patients or these people, because they have a slow heart rate, need the administration of atropine. Atropine is administered to patients with an extreme bradycardia, where we also see that there is a low blood perfusion or their cardiac output is less than what it should be. Basically meaning that your heart is beating so slow that not enough blood and oxygen is moving around. That generating your heart rate to be very slow, making your blood pressure drop down. Those are the patients that do need the administration of atropine to try to get your heart rate back up, to start circulating, stabilizing your blood pressure, and getting enough oxygen and nutrients to your brain and to the rest of your tissues. So yes, some patients may need atropine, but not all of them. Now, right now we're talking about torsades and QT prolongation. And as I've mentioned, this is a tachycardia. So you do not administer atropine to a patient that has already a fast heart rate, because atropine is designed to make your heart beat faster. So a little bit of confusion here on what he's trying to explain. But in a way, yes, atropine is administered to patients with bradycardia, but not every patient with bradycardic needs the administration of atropine. And no, you do not administer atropine to a patient that has QT prolongation or who has torsades. Torsades is treated by magnesium IV infusion, which is also not a standard magnesium IV infusion. A lot of the clinics around the world think that just by administering an IV drip with magnesium is enough to prevent or treat torsades. No, there's a specific dosage that is used when treating torsades with magnesium sulfate. The other thing that always the clinician should know is that whenever magnesium does not control torsades, or when we have a patient that torsades has been prolonged and he's becoming unstable, basically meaning their blood pressure is dropping, you're starting to lose pulse, those patients that do not respond to magnesium, those patients need to have cardiac cardioversion, which is basically the electrical shock you give a heart. So the doctor or the clinic that you're going to must know how to identify torsades, must know the correct dosage of magnesium, and should also know that if this does not revert with magnesium, that cardioversion must be administered.
In order to prevent the development of torsades, I explain all this to say to your audience, do not, under any circumstances, try to order ibogaine online for self-administration. Do not free venture out into the world looking for any old clinic. Be very careful and selective. There are informational websites. One is maintained by a lady by the name of Juliana Mulligan called Intervision Ibogaine Operation.
Yes, definitely. I completely agree with what he's saying. You should always do your adequate research as far as which ibogaine clinic you are choosing to go get treatment. Always make sure that they have qualified doctors with experience using the medicine, that have ACLS certification, that know how to identify irregular heartbeats and how to treat them, as we've mentioned before. But just to give a little bit more information about the QT prolongation and torsades, which is one of the most common arrhythmias and potentially lethal arrhythmias that ibogaine administration can generate, is patients must always be pre-screened before doing ibogaine treatment. So by this, we mean that we need a complete blood workup where we're basically measuring your magnesium, your calcium, your potassium levels, and if they are low, we need to correct them because those imbalances can lead to prolonged QT and torsades. A 12-lead EKG must always be done before treatment to identify if there is in itself already a QT prolongation that we need to correct, or an extreme bradycardia that we also must try to identify the cause and treat. We must always know what medications patients are taking before they even arrive at the clinic, because a lot of medications can prolong the QT. And that's another thing that we must always do to prevent QT and torsades. Identify any medication that needs to be suspended, and some of them even tapered off. We cannot just suspend them abruptly. A lot of these medications, for example, antidepressants, antipsychotics that a lot of patients might be taking, a lot of them can prolong the QT. So we must always, before patients come down, know what they're taking to give the most accurate and safe recommendations as to which medication they can just stop or which medication they need to taper down slowly, but be off before they get here. If you're seeking ibogaine treatment, here are my strongest recommendations. Always ask to speak directly with the treating physician. Ask every question that concerns you. Verify that their medical credentials and experience are not only for the doctors, but also for the entire staff, because they need to identify and manage complex and delicate procedures. Always prioritize the safety. That is a non-negotiable. If you're a patient seeking treatment, or if you're a practitioner looking to integrate ibogaine responsibly, we are available for consultations, training, and guidance to ensure that this powerful medicine is used safely and effectively. Thank you for watching, and remember, knowledge is the foundation of safe healing. Always stay informed and stay safe.